The struggling economy is forcing people to take some major risks with their health.
Last night we told you about people putting off dentist appointments to save money. Tonight we learned people are also not going to the doctor, and small illnesses are turning into big ones. KXLY4's Tori Brunetti is live in downtown Spokane. Tori, this is a growing trend.
Yeah, it's definitely a growing trend among younger people and people who receive insurance through their jobs. Doctors say they are putting off going to the doctor because they don't want to shell out that cash to pay for the copay or prescriptions.
I think they're just putting it off because they have to worry about if they're going to buy gas or buy groceries.
Times are tough and people are doing whatever they can to save money, even if it means risking their health.
It's just a cold and they get better on their own, but it might be an early pneumonia and then the person waits too long to come in and ends up in the hospital.
Dr. Brian Seppi says the majority of people not going to the doctor are people with insurance.
Mainly in younger patients because more of the burden is placed on them for health care in terms of higher deductibles and higher copays.
Depending on what type of insurance you have, copays can vary, $15 to $50 a visit. And when you add the additional cost of prescriptions, for many people these days, a trip to the doctor just got out of reach.
Well, I did have a patient that had actually gone to the emergency room a couple of times because of shortness of breath and didn't have the money to come into the office. When she did finally come into the office, we found that it wasn't asthma that was causing the problem, it was a heart condition.
Dr. Seppi says they have seen a 10% decrease in their patient load, and he expects to see even fewer patients in the future.
As the economy gets worse, we are expecting it to get worse.
And the trickle-down effect continues. Less people coming in because they can't afford it means that this office had to cut back on its hours.
One nurse practitioner that we had to let go over the last 6 months because of decreased volume. So it does affect us.
Now, if you have a cough or a runny nose, you might be able to fight that off on your own, but doctors say if it turns into a fever, if your symptoms are keeping you up at night, or if you're having to miss work, you definitely need to get those things checked out because an office visit is a lot cheaper than having to go to the hospital. Live in South Spokane, Tori Brunetti, KXLY4 HD News.